Hello, my name is Dr. John Krempecki, and here at Cape Fear Eye Associates, I'm a specialist in pediatrics and developmental vision. Today I'd like to take a few minutes to discuss the eye drops that we use in the exam room during your comprehensive eye exam, as well as the eye drops that we use at home to treat certain eye conditions. And finally, I'd like to go through 10 easy steps that you can do at home to properly instill eye drops into your own eyes. It is important to remember that all medications have side effects, and there are a few things that you should know about each of the medications that we use during the exam room, as well as the medications, the eye drops that you use in your home to treat certain eye conditions. The first thing are any side effects that you may have had in the past. Side effects including oral medications, eye drops, or other reactions to other conditions that you need to discuss with us prior to us even beginning to prescribe medications and eye drops for you. It is important that you use your medications wisely. There are 4 things you need to remember when using the medications. Number 1, you need to know the name of the medications. Yes, there are a number of generic substitutions available, but know the name of what you're taking. As you can see, there are a number of different drops we use during the exam room for the examination, as well as items to treat different conditions. Each item has a different cap color. The cap color are responsible for helping us to determine which type of medication or what category or class of drugs that we're actually using. So even if you cannot remember the name of the medication, understanding or remembering the cap color is very important. The second item is to know how to properly take your medication. How many times a day? How often? Every other day? Which eye is it in? All of these things are very important to the proper instructions and use of the medication. The third thing is to understand that there are side effects to the medications. There sometimes are some stinging, discomfort, and irritation that are necessary to treat whatever condition we are trying to improve. Sometimes these side effects are not warranted. If you have them, as we'll discuss later, please call us. The fourth is that if you have any questions, we at Cape Fear Eye Associates want to know about what we can do to better help you understand using your medications. Please call us and our triage desk will be happy to assist you. The first medications I'd like to discuss are the actual drops that we use in the exam room to complete your comprehensive eye exam. Traditionally, there are 2 drops used during the comprehensive eye exam. The first is a dilating drop, a red cap drop. The red cap drop used to dilate the pupils, to open up the pupils so we get a better look in the back of the eye to make sure there's no problems or diseases in the posterior structures of the eye. The second drop is a white cap drop, traditionally used for anesthetic or numbing the eyes. We use those prior to inserting the dilating drops, sometimes to numb the eye, to check the corneal thickness, to also check the pressure inside the eye, and also to do minor procedures around the eye so you're not in any discomfort. One very important fact with the numbing drop: this drop is to be used in the office only. It is never prescribed to be taken home or taken as needed at home, because too much of this drop can actually cause toxicity to the cornea and cause blindness. Another drop that has a green cap to it are preservative-free or non-preservative-free artificial tears. Artificial tears you can buy over the counter. They're used to treat a variety of conditions, including dry eye syndrome. The one thing you need to understand is that preservative-free and preservative artificial tears still can cause irritation and redness. They still can have some side effects, even though they're non-prescription drops. These drops right here we use on a regular basis to just make the eyes more comfortable, sometimes after doing procedures in the eye. The other categories, these are prescription drops that we have. The first type is a white cap drop. The white cap drop is traditionally reserved for antihistamine drops, drops to treat allergies in the eyes. The next drop is a pink cap drop, traditionally used to be a steroid eye drop. Sometimes, depending on the generic brand of medications, steroids can have pink caps, sometimes they can have white caps. The idea is, again, remembering the name of the product is much more important than the color, but the color helps us get into the right direction of what you're actually using. The next color drop is a tan cap. The tan cap is traditionally reserved for treating an infection, a bacterial infection. Most of these drops will have a tan color to it, and it is important that you use those as frequently as prescribed. Sometimes they are used even every 2 hours, every hour, even every 15 minutes. The last drop in this section is called an NSAID, or a non-steroidal anti-inflammatory, sometimes known as aspirin for the eye. These drops are very important to be used to treat some type of eye pain. The last category of drops I have here are traditionally used to treat glaucoma. As you can see, there are a number of different cap colors. The first is missing, it's a yellow cap, it's called a beta blocker. The next cap, a purple cap, called an alpha agonist. The orange cap here, known as a CAI, a carbonic anhydrase inhibitor. The teal cap is a prostaglandin analog. These cap colors right here, the lime green and the blue, are used for combination glaucoma medications. And finally, the dark green is known as a miotic. All of these medications are designed to treat glaucoma by manipulating, usually lowering the pressure, the intraocular pressure inside the eyes. Finally, all of these medications do have side effects associated with them. Please consult us prior to beginning any type of treatment for glaucoma, as we will discuss these in more detail with you. Finally, all of these drops have known side effects. It is very important that we discuss with you all of the side effects with the drops associated with treating glaucoma prior to beginning any type of glaucoma treatment. If you have any questions or have any side effects while taking the medications, please contact us and call our triage desk with any questions. Now I'd like to go through how to properly instill eye drops in your own eye in 10 easy steps. Step 1, properly wash your hands. Washing your hands removes any excess of bacteria that may be on your hands prior to inserting drops in your eyes. Step 2, remove the drop top without touching the tip to any other surface. Step 3, tilt your head back slightly. Step 4, pull down the lower eyelid away from the eye to create a small pocket. Step 5, while tilting your head back and pulling down the eyelid and creating that pocket, look up and place the drop right over the pocket so it goes directly into your eye without touching the tip to your eye. Close your eyes and gently let the drop penetrate into the eye. After closing the eyes for a few seconds, there may be some discharge from the eye. One can take a tissue and gently pat on the outside of the eyelid to collect any excess of discharge. After a few minutes, you may open up your eye. You may feel some stinging and slight irritation to the eyes because of the drop and some side effects associated with taking that medication. Finally, close the cap and place the drop in a proper storage for it to be used for the next time. One final item. Sometimes we have to take more than one eye drop at the same time to treat a certain eye condition. It is very important to wait at least 5 minutes between taking the 2 eye drops or multiple eye drops. We're trying to avoid what's called washout. You put the first drop in and the second one in too quickly, all of the medication are then washed out through the tears, and none of the medication reaches their end targets and treats the proper condition. As we have discussed, there are a number of different medications, eye drops, that are used in the exam room and at home to treat different eye conditions. There are a number of cap colors. It is very important for you to remember the name of the drop, how often you're supposed to take it, any known side effects, and to call us immediately if you have any other side effects that were not described or expected when we initially prescribed you the medication. We discussed the 10 easy ways to put the eye drop into your eye. If you have any difficulties, any questions, or there are some unexpected side effects, we encourage you to call our triage desk immediately to discuss if this is something that is expected or if this is a condition or a side effect that could cause problems to your vision. As always, we at Cape Fear Eye Associates stand here ready to help you with all of your visual needs.